Hi everyone, my name is Dr. Alla Prokhovnik-Raphique and I'm a professor of psychiatry, and today we'll be talking about the impacts of trauma on mental health. As a result of this war, Ukrainians went from having normal lives, much like you and I, to having to hide in bomb shelters, fleeing for their safety, and witnessing and experiencing horrors beyond what we can imagine. Much like we experienced during the early days of the pandemic, life before can feel unreal and contribute to a sense that normal no longer exists. Trauma has a way of changing us, which can contribute to a sense of before and after. Impacts of trauma will vary for individuals, for some being subtle, while for others being more insidious. The impact of trauma depends on the individual's own life experiences, such as past traumas, personal psychological factors, and sociocultural factors. Initial reactions to trauma can include exhaustion, confusion, sadness, anxiety, agitation and numbness, and dissociation. Trauma can impact individuals' sense of hope for the future and expectations about life. There's a grief that is associated with the loss of the way life was. It's important to seek and receive support when dealing with a trauma, whether from a professional, loved one, or community members. Unfortunately, there's a multitude of ways in which trauma is impacting people on the ground. A lot of people are experiencing direct threats to their lives and witnessing injury and death of loved ones, as well as seeing the destruction of their homes, all of which predispose people to PTSD. A lot of the civilians saw and continue to experience traumatic things during the process of escape as well. People report seeing their neighbors and loved ones killed as they try to get away from the horrors. As a result of the draft, men aged 18 to 60 are not allowed to leave the country, forcing families to be separated and leaving many of the women and children vulnerable to traffickers. A lot of the elderly and disabled individuals are not able to take on the intense journey to escape, and family members are being forced to leave each other behind. This contributes to significant feelings of survivor's guilt in a lot of people who had to leave their spouse or aging parent. Some people are choosing to stay with their loved ones who are unable to leave, thus being further exposed to trauma and danger. Many are being asked to make impossible decisions. In my personal experience, speaking with family members and friends, the trauma can overwhelm individuals, making it harder to engage in decision-making process. Thus, the ability to even decide to leave can be hard for people. The sense of helplessness is another factor predisposing people to PTSD, so empowering people to make even small decisions for themselves and including them in efforts to help can be protective against post-traumatic symptoms and can strengthen resilience. There are a lot of ways in which people in the US have been impacted. Those who have family in Ukraine often report a sense that everyday life here feels somewhat unreal, whereas the horrors in Ukraine feel a greater sense of reality. Whether people have loved ones in Ukraine or not, many struggle to tear themselves away from the news and constant influx of horrifying images of human rights abuses that we're seeing. I often encourage people to limit when they're watching the news and to try to minimize doing so in the morning or late in the evening before bed. Much like with COVID, it's not helpful to think of the what ifs or to wonder when this will be over. Rather, it helps to focus on action and what one can do. Vicarious trauma is incredibly real, and people can be traumatized by what they're witnessing, even if it's not happening directly to them. That being said, vicarious resilience is real as well. The strength and the spirit of the Ukrainian people have inspired the world. Focusing on that resilience and helping to channel one's fears into action goes a long way to reducing anxiety triggered by what is going on. Viktor Frankl, a psychiatrist and Holocaust survivor, said, "Everything can be taken from a man but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances. One's perspective goes a long way to boosting resilience. Having a positive self-image and outlook in one's ability is incredibly protective. Having a sense of purpose can help people live on through difficult times. Taking action and making realistic plans, as well as carrying them out, no matter how small, can help people feel empowered and increase resilience in the face of trauma. Having a strong support system is incredibly important in boosting resilience. Knowing that one is not alone and having access to people who are supportive goes a long way. Thus, building a community with others who have shared experiences also helps strengthen one's resilience. The ability to turn one's experience into action makes significant difference in reducing a sense of helplessness, which is another contributing factor in development of PTSD. The Ukrainian people are incredibly resilient. We have seen how survivors of trauma who are able to make it to safety help others, whether abroad or at home. I have seen refugees sheltering in neighboring countries working to help fellow countrymen get to safety and access services and aid. In short, resilience can be built and strengthened through taking care of oneself, building connections with others, being proactive, and finding meaning in helping others. The type of conversation parents would have with their child depends on the child's age and developmental level. Overall, it is important to let children know that it's okay for them to be feeling whatever it is that they're feeling. Creating a space that fosters open dialogue is important for them to be able to express themselves freely. Getting a sense of what they know and what they've heard is a great place to start having this conversation. Empathizing with their feelings is also important. Sharing that you also feel scared or concerned without being overwhelmed can help validate their experience and model positive ways of coping. Depending on their age, sharing geographical, historical, cultural information about the region can help provide context for what is happening, and knowledge allows a greater sense of control. Helping kids take action, like donating a small amount to a humanitarian organization or helping collect supplies for donation, can help channel their empathy into action and again gain a greater sense of control. Having come from a marginalized minority group in Soviet Union, I learned early on the impact that identity can have on one's experience within various social systems. Upon arriving in the United States as a refugee, although safety was no longer a concern, the sense of being an outsider or othered remained. Having to redefine one's identity in a new context can be quite challenging. I feel that I can relate to people's experiences of marginalization and of being an outsider, as well as the experience of having to, in some ways, exist in two different worlds. As a result, throughout my education and career, I strongly felt pulled to work with various marginalized groups and to dedicate my work to helping others who may be struggling in a similar way. For example, I volunteer with the Mount Sinai Human Rights Clinic, providing pro bono psychological evaluations for individuals seeking asylum. Prior to my current work, I was employed at the Addiction Institute of Mount Sinai, where I worked to reduce stigma related to substance use. During my work at Student Trainee Mental Health Clinic, I worked with trainees of diverse backgrounds, helping them navigate the complexities of medical systems while dealing with issues related to their marginalized identities. I appreciate the challenges related to having a marginalized identity and feel strongly about the need to address discrimination and stigma, which I hope to continue to work on through my efforts with the Mount Sinai Psychiatry DEI Committee and the Psychology Coalition at the United Nations. First and foremost, I use my training and knowledge to help my family and friends keep as calm as possible, providing them with resources and help them think through options in an empowering way. I have also been involved in various humanitarian efforts by using my cultural knowledge and linguistic skills to collaborate with various NGOs in order to advocate for people on the ground and help with evacuation efforts. In its most acute form, trauma can overwhelm parts of the brain responsible for making plans and decisions. It becomes incredibly difficult for people to make complex plans and carry them out. I work with people to reduce the sense of being overwhelmed and break down potential options into smaller components so as to make them feel more manageable to carry out. I try to help them evaluate barriers to getting to safety and overcome them whenever possible. Most days, that means being a calming and supportive voice on the other end of the line, letting them know that they matter and have not been abandoned. I know it can feel very helpless and daunting. After all, what can someone living in the US do about a war thousands of miles away? The good news is there's actually a lot that individuals can do to make a significant difference. Firstly, donations go a long way. There are a lot of organizations doing humanitarian work. For example, personally, I've been collaborating with AFG Free, Plain Compassion, and Razum for Ukraine to provide direct aid to people on the ground. They not only deliver humanitarian aid, medical supplies, but also help evacuate those who are not able to escape themselves. Finally, even if it feels small, sharing news and updates on social media and helping uplift Ukrainian voices goes a long way. There's a lot of misinformation going around, and Ukrainians worry that they will be forgotten or their stories will go unheard. Bearing witness to someone else's pain and trauma can go a long way to letting them know that they matter. People of Ukraine are incredibly grateful for all of the support and solidarity that they have received from people all over the